We are so excited that we're at our last session for the Advancing Maternal Health Patient Provider Virtual Connection Forum. And this is going to be a great one because we have a great panel that will be talking about the need for community-based efforts in postpartum care. On the behalf of the American Heart Association, I would like to welcome you all again to this last session. This panel session will explore the critical role of community-based organizations that they play in supporting mothers and birthing people during the postpartum period. Panelists are going to be sharing perspectives on how community-rooted programs address gaps in care, support families beyond the clinical setting, and respond to social determinants that impact postpartum in cardiovascular health. It is, my pleasure to start to welcome our great moderator and our panelists for today's session. So today's moderator will be Dr. Patricia Suppley. She is the director of the School of Nursing and an Aaron Black Distinguished Professor at UNCW. Our panelists are Demia Taylor, who serves as the Chief Operating Officer at Healthy Start. We have Lakeisha Ensua, who is the Chief Operating Officer at Cocoa Life Black. We have Artie Brown, who is the founder and executive director of Conscious Moms, which is a Baton Rouge-based nonprofit dedicated to advancing maternal mental health. And then lastly, but of course not least, we have Tanya Benstel, who is the Executive Director of New Madrid County Family Resource Center. And as a reminder, full speaker bios can be found in the event lobby. From there, Dr. Suppley, I'm going to pass it to you to lead today's session.
Great, thank you so much, and welcome to our panel discussion. This is really exciting, great panel, and we have some good questions for the panel. I am Dr. Trish Suppley, the Director of the School of Nursing and Erwin Belk Distinguished Professor at UNC Wilmington, and currently I'm a consultant to the American Heart Association and an invited expert on the AHA writing group for postpartum myopathy. Again, my research and scholarship really does focus around improving healthy outcomes for moms and also nursing education. I serve on several boards, and in the past, I was an expert contributor to 2 ACOG-AIM postpartum safety bundles. So thank you for joining us here today as we discuss how we can advance maternal health patient-provider connections. Joining me today are several experts who will share information about their organizations, their roles in supporting new mothers, and how we can better serve mothers in our communities. So let's get started. The first question I have is actually for all of you to answer. Can you briefly introduce yourself and describe your role in supporting patients during the postpartum period? So if we can start with Artie.
Hello, thank y'all so much for having me. My name is Artie Brown. I am the founder and executive director, like you guys already said, of Conscious Moms, which is a local nonprofit in Baton Rouge, Louisiana, where we raise awareness and help to decrease the stigma surrounding maternal mental health, while also providing community support groups that provide up to 5 free maternal mental health sessions for our moms within that first year postpartum and that perinatal stage, while providing childcare and a meal for them while they attend these support groups.
Wonderful, thank you. Demia?
Hello, everyone. My name is Demia Tyler. I'm the Chief Operating Officer at Healthy Start, and I have quite a varied background, but I think the most important thing for me to share is that I am a mother of 2 boys that I birthed at the Midwife Center in Pittsburgh, Pennsylvania. So if you were on the last panel, Emily McGahee spoke. I'm also a birth worker, but in my role at Healthy Start, I oversee our research department. And so we develop research to address and examine interventions that can support moms in the postpartum period and during pregnancy to make sure that they have the opportunity to thrive.
Wonderful, thank you so much. Lakeisha?
Good afternoon, everyone. My name is Lakeisha Enswa. I serve as the Chief Operating Officer for Cocoa Life Black. We are a Philadelphia-based nonprofit that serves moms in three key stages: in pregnancy, postpartum, and in compassion in the loss of a child or a loved one during the pregnancy period. We do that through providing doula services with a heavy emphasis on the postpartum period. We also train and certify doulas across the country. And so in my role, is really to set up the back end operating system so that our doulas can support the community effectively.
Great, thank you. And Tanya.
Hello, all. Tanya Van Osdell. I'm the executive director of a nonprofit in New Madrid County, which is in southeast Missouri. And we provide resources to moms and families to help them through struggles that they have in everyday life. And I'll talk about our postpartum part of it in a little bit when we answer some questions.
Wonderful. Thank you so much. And as you can see, we have panelists from all over the country, which is always wonderful. My second question, from your perspective, why are community-based approaches critical to improving postpartum outcomes? Let's start with Demia.
Yeah, so I think my initial reaction was that community-based approaches fill the gaps that clinical approaches don't have the reach to address. But as I reflected more, it's really more than that. I mean, community-based approaches should really be the foundation of our health trajectory. And I mean, to some extent, it is. There's research and data to suggest that our health outcomes are only attributable, the healthcare that we receive only contributes to our health outcomes by about 20%. And the rest of that is social determinants of health. And so this is where community matters most. Ideally, we should have the community conditions that allow us all to equally thrive, but we know that everyone doesn't have access to the same conditions. So that's where community-based approaches come in to level the playing field as much as possible.
Great, thank you. Artie, the same question.
Yeah, so just piggybacking off of Demia, they're crucial just because they're already there, they're consistent, they're boots to the ground, they are culturally responsive to the population that they're serving, as well as being accessible. So we know like the main deterrents of people seeking help and assistance is transportation, lack of childcare, things like that. So it's always great to go ahead and just go where people are already getting help and just, being like a complimentary service and meet them where they are. So that is the crucial part, like she said, to fill in that gap where they're not able to come, to where they are and meet them. They're already there.
Great, and thank you for bringing up the social determinants of health, because we all know how important they are to the work we do. Lakeisha.
Yeah, just to add to what Artie and Demia said, I think it also takes us back to our roots. Many moons ago, before we spread out, and we used to live close to our families. A lot of people lived multi-generationally, and so that community support was built into our families. And so I think right now, community-based organizations are recreating those villages that used to exist and providing the support right where people are, where it's easy to access.
Thank you. And Tanya.
So we provide resources to families. That's our thing. No matter what's going on with the family, we try to meet the need of that family. But for stronger postpartum outcomes for us, how we look at it, we look at like the whole family's environment, everything that is going on in the home and what is making things not work out correctly, and make sure that they have support systems and that everything is in place, even past the clinic setting, and just trying to work on the family as a whole too, because if it's not a healthy family, it's no one's going to be healthy. So that's really how we kind of look at it. Like, what do you need? How can we meet that need? And how can we make sure that you have support, especially in times of crisis?
Great, thank you. And it sounds like you're all basically focusing on a holistic approach, which I believe we do have to extend it out, not just to the person, but to the family and the community. So thank you. Speaking of your organization, Cocoa Life Black's perspective, what are the most common gaps patients experience after birth? And why are community-based organizations essential to address them? Lakeisha?
Well, I think the biggest thing is, that gap in care. So you deliver a baby, you leave the hospital, and then you're likely not to see a clinician for at least 4 or more weeks after that, at least not your own clinician. And so there's the first gap. It's who do I turn to when I have questions? If there is a problem, I don't want to go to the emergency room. I've got all of these new responsibilities. And so that's really where the community-based organizations kind of step in. They're also able to build long-term, deep-rooted relationships that the clinical setting can't always do. And so we are with families sometimes for their first baby, and then they come back for their second, and sometimes they'll come back for their third. And so those are deep, long-standing relationships that have built trust. And now there are things that we are privy to, information, needs that the clinicians just don't have. And so that really is helping to close the continuum of care. So things that you go to your doctor, you might always not always tell them the truth of what's going on. But if there's a doula, if there's a community health worker, if there's a nurse, home visitor in the home, they're seeing things that the clinicians don't see. They're able to work with them in ways that the family might not necessarily be comfortable in communicating themselves, but they trust that advocate to go in with them and help them to communicate their needs so that they can get the support. So I think that we like to think of ourselves as the mutual best friend between the clinical setting and the community. We're there to bridge the gap in whatever way that looks like. So if it's with the clinical team, if it's with social work, if it's with other resources like food or housing insecurity, we're really there just to kind of hold their hand and walk through it with them so that they don't feel alone.
Wonderful. Thank you so much. Artie, in the context of postpartum care, how does community-based support help break down the stigma surrounding mental health?
It is actually like the huge difference maker just because it's a space that you already know, so it's not foreign, that you feel safe in. And it's relatable, and it also just provides a space where moms can feel seen and heard. And half the time, that's the major part. A lot of moms just want to be seen, they want to be heard, and know that they're not alone. We talked about the isolation already piece. So when you start having conversations about postpartum depression or anxiety or OCD or just being overwhelmed or just having an identity change, right? You went from just worrying about yourself or doing your day-to-day things to now you're including another human being that you're responsible for and all the thoughts and the things and then uh, and just keeping up with all the things that you have to do because things are just added to your plate. Nothing's taken off or being replaced, it's just being added. So being able to have these groups in a community where you already are with people you know and people you trust, and to know that you're not feeling this, you're not alone in how you're feeling or what you're going through, and be able to talk to somebody, that's therapeutic in and of itself. And it also helps to just normalize seeking help because, like I said, it's a huge stigma just in general with mental health. And I almost think it's a double one with being a mom and saying, oh, I'm struggling, because we think it's a natural thing. Oh, I'm a mom. You got this. Like, why are you struggling being a mom? Like, you were born to do this. And so a lot of people feel shameful for saying, oh, I'm feeling overwhelmed or I'm having a problem or I'm struggling being a mom for something that should come natural, that our moms or maybe our grandparents, didn't need. But that has changed also. A lot of our parents, our grandparents and beyond did not work, they only focused on the home. And now we have a lot more single mothers and a lot more working mothers. So there's those things. So just like I said, meeting those moms where they are in the community, where they are, just helps them to get help earlier, and not feel ashamed. And also for other people to catch it earlier before it becomes a problem, right? When we start noticing, oh, you know what? They're isolating a little bit more, or I notice, like even with the kids or with the mom, they're just not the same. Something's kind of off. So it just increases, getting help and seeking help. So like I said, I think it's the best thing to seek out a community center and have that be a way that we reach our moms, because a lot of moms aren't able to make it to the doctor's office, or just go seek help on their own.
Great. And I'm so glad to hear, you're talking about mental health and, we really have to address it at every interaction because otherwise there's potential fear sitting there versus, if we normalize it more, perhaps it'll, that stigma will hopefully keep going away. But we still have work to do, but I do believe our community in the maternal realm, we're doing a better job at that. So thank you. Demia, from your experience, why is a doula-led, culturally responsive approach especially important for addressing hypertension among Black patients in the postpartum year?
Yes, thanks for asking this question. It is an important one. And I kind of want to build on what Lakeisha said earlier, because Healthy Start Incorporated is a community-based organization that focuses on maternal and child health. And so our doula interventions exist within that context. And there are hospital-led doula groups, and they have their role, they have their purpose, they meet the needs of some birthing people, but to just dig in again about the importance of community support. Community doulas bring an additional dimension of having an understanding of community conditions, both resources and needs. And they're often able to build relationships that allow for deeper trust. Again, back to what Lakeisha was saying earlier. And so Healthy Start, along with McGee Women's Research Institute, launched a study to examine whether postpartum doulas equipped with enhanced heart health competencies could support moms diagnosed with hypertensive disorders of pregnancy to return to normal blood pressure in the first year after birth. And I can't speak to the official results yet, but what I can say is that participants have spoken to the connections that they created with their doulas and the support that the doulas were able to provide. And our doulas, in this program, they supported moms. They reinforced the importance of blood pressure monitoring and the correct way to monitor the time, so not immediately after coffee, how you should be positioned. Our doulas also provided support with lifestyle changes and task support, such as light housekeeping and things like that. Those are things that require trust, and that has to be built over time or through a shared connection. And that's what makes community-based doulas so important to supporting Black families in the postpartum period.
Yeah, wonderful, wonderful, and I love your connection that you've made. Between the provider, but also the importance of the education that can be shared. And sometimes it's not a one-way street; it's a mutual sharing of education to get to know what the patient's really thinking and understanding, and then vice versa. So thank you for that information. Tanya, based on your work in the New Madrid County Family Resource Center, how do social determinants like employment, food access, and education interact during the postpartum period to really shape long-term health and stability for families?
Thank you. That's wrapped completely. That question is around what we do here. We see every day that how we play a part in postpartum health by making sure that the resources that the family needs are there to help them that in that very stressful time in their life, they're bringing a baby into the home. And then they're also worrying about who's going to pay the rent, who's going to go out and get groceries. The electric bill is coming due. And so we're there to try to help them find the resources and provide a lot of them also to help that family not have such a stressful time for themselves and for this new baby that's come into their lives. And so we want to make sure that we can provide as much as we can to have a safe and stable family. Just an example, if a mother works at a position where she doesn't get any time off because she's having a baby that's going to be paid. So there's that gap, and she doesn't know when she's going to return to work. So she's going to miss appointments the baby, there's all kinds of things that's going to start a path to leading that family to a healthy, unhealthy position. And so high blood pressure, the stress, the lack of resources to help pay their bills. And so we try to help meet them. And we, as everyone said when they're talking, meet them where they are and help them try to overcome those so that they can move forward and work on with their children. So all of these factors, we all have to work together to be able to meet all of these community-based organizations, clinics, and we've really started this thing here in this area. Our clinics have always been very not in touch with what resources are available outside of the clinic experience. And so we've started a new thing here where we're all on a platform and we're making resources and referrals to each other so that we can make sure that the families are getting what they need. So that's the only way to have a stronger postpartum experience and outcomes for everyone, and to keep everyone safe and have support systems. So. We provide just one other thing. We provide a lot of things. We have these wonderful maternal health kits, diapers, wipes, safe sleep surfaces, car seats, home visiting. So a lot of our programs are centered around that maternal health, and just trying to get the family to where they need to be.
Wonderful. Thank you so much. This question's for everyone now. Many mothers disengage from formal care after delivery. What are some strategies to keep new moms engaged in taking care of their health? So again, depending on the state you're in, you may see numbers that moms don't return for postpartum care, for example. So if anybody is willing to share some strategies, that would be wonderful. So again, I could start from the top again. That brings me to Demia. Any thoughts on that one?
Yeah. Yes. I mean, I think the first step is really to understand the everyday context of each of our moms. So at Healthy Start, we complete a postpartum plan. This is very similar to a birth plan. But within it, we assess like who are your support people? When are you intending to return to work? What type of leave do you have? What are your access to resources? And this helps us to understand the social conditions of each individual family. And then we can identify effective strategies to best support them. And, we mentioned earlier, this comes in the form of removing barriers such as childcare, transportation, health literacy, the time that it takes to navigate our very complex medical system. It might come in education, like about why the postpartum visit is important. I remember when I first started working at Healthy Start, someone who worked here at the time said that like they didn't go to their postpartum visit. Why would I go to the postpartum visit for them to push on my stomach? And so just like really educating and making sure that families understand why that visit is so important and what are the risks of not having that visit. And then just that continual engagement. So making sure that you have a PCP, making sure that the post-birth warning signs and are able to act on them. But all of that takes understanding where families are to begin. And I believe that all moms ideally want to take care of their health. So how do we remove the barriers and provide the access to help them to do that?
Great, wonderful. Thank you. Artie, anything else to add?
Yes, so I know, like she said, postpartum, so they are coming while they're pregnant. So I think it's important for us to capitalize on that. So while they are pregnant, get them set up with somebody. And I think that's where the importance of a doula or a midwife. They are in the home, they follow them the whole time. They already have a relationship built up, a trust that's built up. So I think capitalizing on that, there are case managers that I feel like with these community-based organizations that have been crucial to following up with a mom, even meeting them at the grocery store, meeting them at the school, meeting them at a park, wherever. Different people have different fears. Like if you come into my home, you're going to call child protection, so I'm more willing to meet you at a park, or I'm more willing to meet you virtually, or you can meet me at the grocery store, or, just come where I am, where I feel comfortable, and I build that trust. And I think that has to happen before postpartum. I think it needs to happen while they are pregnant having the baby. And like I said, just having somebody that is following them alongside the nurses and the doctors in the clinic to really keep an eye on them and go over, checking their blood pressure, and just if they are having any pain or anything that's abnormal, or if they're not feeling like themselves, or if they need some community resources, which there are tons of resources out there. And I know a lot of times it can just feel overwhelming to a mom. So I feel like talking to her or letting her know what's available before she has baby, and then she feels overwhelmed, because we've all seen videos all over social media about you get no rest once you have the baby. Nurses and doctors are coming in there constantly. They're like, okay, I'm gonna let you get some rest, but I just need to do this check. I need to see if the baby ate. I need to check your blood pressure. I need to check your stomach, like all these things. And moms are just overwhelmed. And so I think it goes better if we capitalize on, like I said, that during pregnancy portion.
Right. Absolutely. I think the other thing I'd like to throw in here is not for providers to make any assumptions. Because I think in the past it was always introduced as, well, why didn't you attend that visit? And it's like, you know what? Let's not make any assumptions here. So I did want to throw that in because I've seen that with my own research. Another question we have is, where do you see the strongest opportunities for collaboration across disciplines? And where does coordination of care still need improvement? And Lakeisha, I was wondering if you could help us with that one.
Yeah, I think one of the biggest things that we've seen are clear referral pathways, particularly in emergent situations. And so we've worked really hard over the last couple of years to build strong relationships with our hospital systems. In the Philadelphia area, we have 3 very large hospital systems, and we've worked to build relationships so that when there are things, mom doesn't want to take her newborn to the ER and sit for hours and hours because something is wrong. So who do we call? How do we fast track this? How do we at least get her on the phone with somebody who can answer some questions and determine if she really does need to go to the ER, or if this is something that can wait until, the next day where she can get an appointment to see the physician. And so I think clear referral pathways is something that's really important. I think the other thing is open communication, two-way communication. And